diagnosed with a chemical imbalance, manic depression.
They diagnosed me with having ADD.
They told me I had conduct disorder,
ADHD, mild depression,
Major depression,
depressive,
borderline personality disorder, impulsive disorder,
anxiety, depression, and schizophrenia.
disorder.
There's no such thing as mental disorder. A mental disorder is whatever someone says it is, and if the person saying this is a mental disorder has enough power and influence, then people believe, oh, that's a mental disorder.
Pero no se puede tener poder o influencia sin credibilidad. Así que la psiquiatría fabrica la suya.
is based on a grab bag of checklists for disorders that are published in a book called the DSM, which is the Diagnostic and Statistical Manual. There are no statistics in this book, by the way. That just makes it sound more scientific.
They create this cluster of disease, and they get together and they vote. Is this a disease? All in favor, say aye.
It's marketed as a scientifically based document. Now, the American Psychiatric Association, which publishes the DSM, do a lot of work to create an aura of scientific precision around the DSM, but it's not scientifically based.
Desde la primera edición del DSM, el número de trastornos mentales que se incluyó por votación en el Manual de Diagnóstico de la Psiquiatría ha llegado a 374. Y con cada nuevo trastorno, los psiquiatras crean otra forma de defraudar al público.
If you have 27 ways to bill in DSM, that's 27 ways to bill. If you have 300, that's 300 ways to bill. So you can pretty much find anyone walking on the street that could fit into a DSM somehow.
When you build an insurance company, you can't say the word. You've got to send in a number. And they have numbers for the most ridiculous things. You know, like arguing with your mother or peeing in the bed.
Adolescent rebellion disorder is an official psychiatric diagnosis. Arithmetic learning disorder is an official psychiatric diagnosis. General anxiety disorder is a recent diagnosis.
For each one, there is a 5-digit code with a decimal point. Now, the implication of that is if I have illness 403.16, that's different in some important and scientifically proven way from someone who has 403.17. And nothing could be further from the truth.
Aunque parezca increíble, mientras presentan el DSM al mundo como un hecho científico, los psiquiatras admiten libremente su absoluta falta de base científica.
We have no diagnostic reliable markers for almost any illness there is in the DSM.
What we're testing for in psychiatry, it's hard to say because there's nothing specifically.
But as far as a test that's clinically useful, basically we're not there yet.
We don't have any laboratory tests that we can use to determine whether somebody does or doesn't have a mental illness.
There are no good biological tests for detecting mental illness.
There is no test, there's no biopsy you can do.
There is no chemical test right now.
There are no specific tests to confirm the diagnosis or show the improvement, like any blood tests or any x-rays or anything like that.
Oh, in my practice I don't do any tests. I just speak with people and listen to them, and then I make a decision in what kind of illness.
Estos diagnósticos varían tanto como los psiquiatras que los dictaminan. En estas secuencias, tomadas con una cámara oculta, una persona visitó a varios psiquiatras quejándose de los mismos síntomas.
I'm extremely unorganized, and I didn't used to be. It's caused problems in the family. It's caused problems getting, I'm self-employed.
So you've got ADD, ADHD, you're depressed, and you're depressing is bipolar depressed.
Do you have a brain chemistry disorder? Is probably genetic.
You have a lot of the symptoms of depression.
So it seems like it is a mixed picture. What that means is like we got some depressive symptoms and some, high symptoms.
If you're bipolar, only give you a mood stabilizer. We don't know. I can't doubt it.
Considered low-grade bipolar.
You are more of the ADD than ADHD.
And as far as medications for depression, because I would recommend
that you start a medication, which are Prozac, Zoloft, Paxil, Celexa.
Usually propylene XR is pretty good.
They'll give you some Lexapro in the morning and some Trazodone at night.
Lamictal is a better medication for that. It works on your depression also.
But the treatment for any bipolar cycling is the same. Lithium,
Bromar is another one.
Trazodone,
Segredol,
Rivergood, Wellbutrin,
Lexapro,
Lamictal,
PSIQUATRIA,
Depakote,
Lithium, Ambien. You may need an antidepressant also with your Lamictal.
We don't know if I give you a medication if it is going to work or not.
To a certain degree, it's trial and error.
You never know if it's the right drug.
How many people have I cured? Well, there are no real cures right now in psychiatry.
I have cured none of my patients.
We're always challenged by our lack of knowledge.
I mean, in fact, we don't know what the causes of mental illness are. Most mental illnesses, we do not know the cause.
Of course, it would be nice to know exact reasons of disorders, but maybe in the future.
I'm the Director of Research at the American Psychiatric Association. We don't know the etiology of really any of the mental disorders at the present time.
DSM-5 is coming out. It's grown to 10 times its original size, and it labels everybody. I could find 5 diagnoses that would fit you or anybody else.
Compara esto con los métodos de investigación de la patología, una ciencia real que descubre enfermedades reales usando una amplia variedad de pruebas de diagnóstico precisas.
We do millions of laboratory tests as well as the structural examination and the microscopic examination. It's a whole series of applied scientific procedures. In the case of psychiatry, there isn't any laboratory tool that can precisely identify a psychiatric disease and allow it to be classified.
It's not as if there's some study of tissue or some study of the body or some study of matter. These are all categories which are made up. They're simply made up. They don't exist in nature. They're decided upon by psychiatrists and voted on.
Los psiquiatras no son los únicos que se benefician con el DSM. Siempre que se encuentre un diagnóstico psiquiátrico, se encontrará una droga psiquiátrica.
The pharmaceutical corporations now contribute enormous sums of money for the education of psychiatric residents and for the support of research by their professors, so that psychiatry today has become in America, has become very largely learning which drug to use with which disease or disorder.
We need to make sure that we understand the very close interactions among the American Psychiatric Association with its DSM, the pharmaceutical companies, who love the fact that every time there's a new edition of the DSM, there are dozens more categories in there, and so more conditions for